Prabhat, who will speak and answer questions on hearing loss in the elderly. Dr. Prabhat completed his undergraduate and postgraduate studies from the GS Medical College, and that's the KM Hospital, and then worked as a lecturer there for 4 years. He's trained in ear surgery for deafness from Germany and has done cochlear implant training at the Royal Australian Hospital, Melbourne. He is the author of 4 books on ENT, of which Practical ENT is in the 31st year of publication. He has published over 40 published research articles in various national and international journals and is on the editorial board of 4 index journals. He has delivered over 400 lectures at various conferences. And he's a consultant to the online site pediatriconcall.com. He's a section editor and author of the ENT section of the IAP Textbooks of Paediatrics, Textbook of Adolescent Medicine, the IAP Culture Atlas of Pediatrics, and a textbook of tropical allergy and asthma. He's the head of the department of ENT at the Wadia Children's Hospital in Mumbai, and is also a consultant at the Jaslok, Raheja Fortis, and Bhatia hospitals. He's been a guest speaker at various World Congress of ENT at Sydney and Cairo, and also at the AAO Washington. He's an examiner for the MBBS, DORL, and MS examinations. Dr. Prabhat was president of the Otolaryngologists of India, that is in 2000, and nominated in the top doctors from 2013 to 2021 by India Today magazine. We are delighted to have you here with us, Dr. Prabhat. Welcome to Health Live at Seniors Today.
Thank you, Mr. Maheshwari, for a very warm introduction and a very socially useful program that you have put into. And
thank you. Thank you very much. One of the things which I always ask people who are doctors like yourself, and we try to dip into their insights, because we started the Health Life series when the first wave of the pandemic was there, and there was a lockdown, and we felt that these sessions help facilitate knowledge to people. Since you visit all these hospitals and you're up close with what is happening around, where do you see the current situation of the Omicron virus infection?
Yeah, basically it is now, it'll be ebbing. I mean, it'll be going down. And what we see is it doesn't enter the lower respiratory tract now. People get well in 3 to 5 days. In 5 days, they are up and about. So I hope that Omicron will basically overshadow the Delta and things will be much better in 2022.
But doctor, one thing which we have seen is in a city like Mumbai, where we are seeing numbers which indicate ebbing, but there are a lot of people who are testing by home kits, and because the one of the problems with COVID is, and unlike malaria and dengue and everything, is that it basically locks you up in the house, and no domestic help is allowed, and you are kind of you have to be just caged in your own home, especially if you're in a housing complex. But the numbers haven't really gone down in Delhi. Yesterday I saw the numbers in Bangalore were over 18,000, etc. So is there something that you yourself, as since you are on the front line virtually and you have a lot of patients whom you interact with, what would you recommend, other than the masking and all of that people are looking at? Is there something special that you would suggest to our viewers and listeners here?
Basically, we should continue the social distancing, masking, and hygiene itself, and be mentally relaxed. I mean, don't get perturbed, don't get panicky. It is not causing the type of things what you see on TV or things which are coming from WhatsApp University. So basically, just off your TV, don't go and be driven by media. Just sit back and relax. We don't find patients in ICU with this present condition.
Right. Thank you for those words of advice. Well, you can ignore some media, but do do keep in touch with what we are doing at Seniors Today. We are fairly responsible in our approach, if I might even say it myself. And we do look at doctors like Dr. Prabhat, who are here, and as you know, that we have had very senior pulmonologists like Sujit Rajan, like Aditya Agarwal, and the like, who have come here and spoken to all of you. So now over to you, Dr. Divya Prabhat, for your session on hearing loss for the elderly. Those of you who have questions, as always, put them on the Q&A tab, and do mention your age and your gender, because that will help Dr. Prabhat address your queries better. Over to you, sir.
So we'll go and address the issue of hearing loss in the elderly, as Mr. Maheshwari has told you. Now, the ear is one of the most important organs in the human body, with the same similar concept that it is the first organ to be developed in the human body. At 20 weeks of gestation, that is in the womb itself, the adult ear is fully developed. You must have heard stories of Abhimanyu and Mahabharata and all. So it is the organ which is developed even in utero, and at birth, the ear organ is cochlea, that is fully developed. So the importance of a fully developed ear is not only important at birth, but even before that. Now, in our country, the population dynamics is changing, and we find the elderly population from originally a pyramid is going towards an inverted pyramid. Now, this is the hearing organ which is responsible for all the sounds that we hear, and I'll just briefly take you over to it. Now, when we have this is the part of the ear which is the inner ear. It takes sounds and goes to the brain, and therefore in the brain we have the hearing center that you see. Along with it is the visual center. Now, this hearing center develops only when sound enters the brain. When the sound stops entering the brain, the channels from the ear to the brain do not develop, and the hearing center is lost to the visual center. So the development in the brain only occurs when we hear the sounds, and these thaw the freeze pathways going to the brain. Now, what happens that when the hearing is affected, things like lip reading come to the rescue. We are very smart. The lip reading we catch up, and some of us are such good lip readers that they can anticipate and find out what the person in front is talking. But as Pradyumna just said, that we are facing a pandemic now, and because of that, masking is one of the very important factors which have come in. So masking prevents this lip reading totally, and understanding speech becomes much, much more difficult. So lip reading is out, which was to the rescue to understand for a hearing problematic person. Now, the basic mechanism of hearing, to sum up, goes in this manner. So this is exactly how sound enters into the ear and goes to the brain.
We can't see it, doctor. Sorry, doctor, we can't see your screen.
No?
No.
Can you see it now?
No, we can't. We have not been able to see it at all.
Oh. You saw the initial slides?
No, nothing at all.
Oh. 1 minute. I have done share the screen.
It worked all right earlier.
1 minute. I'll do it again.
Yes, please. Yeah, it's now sharing.
Sorry.
Now sharing. Yeah.
Okay.
Yes, absolutely okay.
So just run through it.
Yeah.
So the human ear is one of the most important organs in the body for the simple reason that the inner ear or the ear is formed to that of an adult size even at newborn, in a newborn. And at 20 weeks of gestation itself, the ear is fully formed. As you have heard the story of Abhimanyu and all in the Mahabharata. Now, this gives you the importance, how important the ear is. Now, the thing is that in the human body, I mean, and the ear is placed in an organ which the bone, which is the petrous bone, and it is the hardest bone of the body. So it is most protected organ as well as the first forming organ in the body, and that gives the importance of the ear. Now, in our country itself, you can see the pyramid of age, and this will change as time is concerned, and the pyramid will become an inverted pyramid with time. This is how the inner ear is seen, and we'll just go into the basic of it, that the inner ear collects sound which goes to the brain, and these are the auditory or the hearing parts which are formed, which lead to the hearing center. Now, this hearing center would not develop if the sound does not enter the ear, and the brain part of the hearing center gets occupied by the visual center. So if we do not use the hearing part, the brain does not develop. So this is one of the most important messages that I would like to give you today. Now, we are very smart. I mean, even with hearing problems, many of our patients do lip reading. You can find out, decipher what the person in front is speaking, and you can know or try to assess what the thing is. But the problem is with the pandemic today that we all are using masks, and this compounds the problem of lip reading gets eliminated because this cannot be used. The hearing mechanism is, in brief, so this is how sound is formed and it enters the brain. Now, the commonest causes that we find with the hearing is aging. Now, aging, or called as presbycusis in medical term, is a physiological condition. It's not a disease in any manner. As we get older, the hair cells which you saw in the earlier picture, they get affected, and this causes a hearing loss. Secondly, the most important thing in our metropolis is noise. Noise is the commonest cause of complete damage to the inner ear. Thirdly, would be medical conditions, could be like Meniere's or various infections can affect the ear. And lastly, medications that we take may have certain side effects causing a hearing loss. So we have to firstly be away from noise if you want to protect your ear. It is seen that those who even stay near the railway lines or near the airport, etc., they tend to get more affected with noise, and their sleep gets affected. There are even the chemists over there. Apparently, they sell more antihypertensives, anti-diabetics, antidepressants, and even antacids. So noise is one of the biggest factors which can be preventable as far as this is concerned, and which has become a day-to-day part of our daily life. Secondly, would be the drugs and medicines that you take. Most commonly, even for our elderly people, aspirin has become quite a routine that, which is prescribed. Aspirin has also effects on the ear, and therefore ear testing is very important. All the aminoglycosides like gentamicin, kanamycin, streptomycin, as you all know, damage the ear, and therefore we have to be very careful while taking medicines for a long term. The things which are affected in the ear is the inner ear, and the inner hair cells get affected, and they are the basic cause of hearing loss. So this is the organ which which is responsible for the hearing, and the hair cells, if they are damaged, it would lead to no generation of electrical sound inside. And this is how, where an implant is done and the electrical sounds are produced. So what is the effect that occurs because of this hearing loss in our elderly population. The problems are associated, we find them that you find depression, they get withdrawal from social life, they become very lonely, there is anger which develops, there is reduced personal safety, definite cognitive decline is there, and poor health. So this is how there is an emotional impact of a hearing loss in our seniors. Now, if you see, the incidence is quite high. Even from 65 to 74 years, 1 in 3 of the Americans studies have shown that they suffer from hearing loss. And when we consider people above 75, it is in every second person. So the incidence is so high, from you can say 1/3 to half of the elderly population is suffering from this. And the problem is that the warning signs, when they ask somebody to repeat what is said, they miss out on words. Many of them have ringing, buzzing sounds in the ear, which is tinnitus. These are many of the indicators, and these all can be managed or treatable comfortably. So it is not the patient who complains of it or gets to the doctor. It is usually the relatives or the associates who get them, because the person who's suffering from a hearing loss feels that he's not losing anything. He has no law and disability. So hearing amplification not only reduces the loneliness, it delays dementia and improves the quality of life. So basically, as I said, we get a hearing test done, and the hearing test would tell us what the hearing level of the person is. Now, very important is that all the seniors who have this hearing affection with the cochlea also have difficulty in balance also, and they come out with different forms of vague symptoms and also develop ringing in the ear, which is called as tinnitus. So this tinnitus or ringing in the ear is also distracting, which again needs to be treated at once. So the test which is done is called as a pure tone audiometry, which tells us that what the hearing of the person is. So there are two types of sounds that are seen. One is what we hear from outside is called as air conduction, and what we hear our own sound is the bone conduction. So these two types of sounds we have. So therefore, what happens whenever you find an elderly person, you will find them speaking very loudly. The reason is that their bone conduction is affected, their inner ear is affected, so they themselves cannot hear their sound normally. So when they cannot hear their sound normally, they will speak in a loud tone, and one might feel that they are angry. So it's always that a sensory neural person would speak loudly, and generally, if you are, you may feel that they are appearing angry. It is not. The reason is that one does not hear one's own voice normally. So if one speaks loudly also, it can be an indicator of a hearing loss in the elderly people. So age related is the first cause of hearing loss, and that how it affects, it is just not a symptom, but it has to be treated. It is like on the bonnet of a car, if you see an indicator coming, you don't keep on driving down. You stop the car at the side, open the bonnet and see what is wrong. So rather than waiting for the car to collapse and landing with a central disorder, it is better to just find out what the cause is. So get an audiogram done, which shows a high frequency loss. You can see the sloping curve. This is very typical of age-related hearing loss. And this tells us that now the high frequencies are affected. These sounds are missed. And this missing of sounds leads to various things like avoiding social participations. First of all social participations are avoided. Isolation occurs, depression occurs, and the person keeps on getting withdrawn, and even dementia and Alzheimer's starts off with all this. So various types of hearing aids are not totally, they're so advanced that I can isolate even noise. Like when we are outside, the sound of winds is cut off. There's music can be appreciated by a person. They can use it through Bluetooth, or even streaming, audio streaming is done. Tinnitus can be reduced. So all those things can be done with a hearing aid. There are different forms available. Now, especially in the diabetics, it is very important that hearing loss is nearly 50% as far as the diabetics are concerned, and that has to be treated. Now, the red area will show the area which is lost because of age-related hearing loss. So these are the sounds that are lost by the people. So what they do is they fill in the gaps by trying to guess and fill in the gaps. These are different hearing aids that are produced, but hearing aids were not used as they were supposed to be an handicap. But now such small devices are also available which go into the ear canal, which really speaking are not seen, and much bigger than those devices, which, you know, if Beckham wears and he wears a much larger piece outside, becomes a fashion statement. So Bluetooth is a fashion statement, but an hearing device becomes an handicap. So it is why only 1 in 5 of those who require do not use hearing amplification, because they do not know the benefits of it. They blame others. There are, of course, them considered a stigma. They are misinformed and they failed at using a hearing aid, and the expectations sometimes become too much. The basic consequences are that speech recognition or one-to-one conversation does not occur. In small groups, they would withdraw because when many people are speaking, they would miss out on words and particular speeches would not be understood. So what is important is use it or lose it is the edge of today's the message that I would like to give you. So the two things that which can be done is, one is using a hearing aid or bypassing the ear by doing a cochlear implant. So just for your knowledge, I'll just inform you what a cochlear implant is. So basically, this is a picture of Mr. Gujral, the very famous artist. He got an implant done in the year at the age of 75. So at a time when one would think of basking in the laurels of his successful life as a sculptor, he started painting, and till he painted till he was 94, I think. So this would definitely not only change the life of a senior person, and what happens that with hearing amplification, it is that when we are missing words, the thought process gets affected. The mental faculties get occupied in finding out what is being heard. So the further actions get affected because all energies, mental energies are towards that. This is about the mobile, of course, for the youth, that one of my articles, but this is another topic by itself. So what I want to tell you is that if you use the ear, the nerves do not degenerate, the nerve pathways are strong and newer activities can be built up. When the nerves are not, the ear is not used, automatically the nerves degenerate and the brain loses the hearing center and leads to things like dementia and other neurological conditions. So to have an active life, communication, social and otherwise, hearing becomes very important, and therefore you should get tested and use the ear maximally. So again, the essence of all this is use it or lose it. So unless you use your ear, you will find that the brain shrinking, the area will be lost and we lose the capacity of hearing. Thank you. Thank you for your questions, please.
Thank you, Doctor, for this very extensive presentation. And we have quite a few questions that have come in already. And I'm going to go to the questions right away. So the question from Mr. Rajpal Singh, and even as I'm going through the questions, perhaps there are more of these, but which hearing aid is the best?
Most of the hearing aids are quite similar because their work is amplification of sound. There are different types of hearing aid. Earlier, we used to use pocket ones, but instead of pocket ones, now we use post behind the ear, in the canal, completely in the canal. So depending on your cosmetic acceptance, use that type of a hearing aid. The results of all of them are the same. The only difference is the cosmetic one and therefore the cost.
But doctor, I've had this. I had bought a cosmetic one, as one could call it, for my father, and I remember, changing the batteries, etc., was exceedingly difficult for that. While it is programmable and all of that is there, but is that now better, or is that still the same?
Exactly. The battery thing is a thing of the past now. It is like your mobile phone, like you can directly charge it and the hearing aid gets charged. So you don't require to remove the battery or change the battery. So battery thing is eliminated now in many of the hearing aids.
Right. Thank you. We have a question from Mr. Brij Duggal, who's 78. He asks, lately I started reduced hearing in my right ear. Sometimes my ears pain. What should he do?
Basically, should get his ears checked up because hearing loss would be one issue. But I would just like to tell him that hearing loss in the elderly does not cause any pain. So that is a painless condition. Probably he must be having something else rather than just a hearing loss.
Right. Thank you. We have a question from an anonymous attendee who says, I wear a hearing aid but still do not hear well enough. Is it inevitable to hear less with age?
It is inevitable, but if you constantly use your ear, then your hearing would not progressively go down because the brain gets rewired and even develops. The brain is much better than a computer. So it produces alternate routes, and therefore you can prevent this fall by using the hearing aid or using any amplification of sound in a proper manner. Now, if you cannot hear this properly, which means your hearing aid or the machine requires to be, altered or needs to be, you can program what we say nowadays.
We have a question from Mr. Brijendra Kumar, who's 76. His question is tinnitus a treatable condition?
Yeah. See, basically, tinnitus is perception of sound in the absence of any relevant external stimulus. Now, if it is an objective tinnitus, it is totally treatable. If it is subjective tinnitus, with various methods, the tinnitus can be reduced to a considerable extent because there may be a cause like, hyperlipidemia, hypercholesteremia, hypertension, diabetes, even all of these also will cause tinnitus.
Right. Thank you. We have a question from Ms. Vinita Kamath. She asks, she's 71, and her question is about hearing loss in 1 year after catching a cold. Is that something that could happen? Her statement is that I had severe cold 10 days back, now unable to hear on my left side. I'm taking treatment.
Yeah. Cold is one of the commonest causes of hearing, and respiratory tract infection from the nose and sinuses directly gets into the ear and causes a hearing loss. But this is obviously a treatable cause. Unless not treated, neglected, then it can damage the cochlea, what we have shown in one of the slides, and that can be a permanent loss later. So the earlier you treat it, the better is the prognosis and better would be the results.
This is a question from Devendra Gada. I know he's not a senior, but I'm still going to ask, because it's an interesting question. His question is, and you address this, that due to diabetes, which part of the inner ear is affected, and what tests do you recommend for diabetics on a regular basis as far as ENT is concerned?
Basically, with diabetics, the cochlea and the cochlear nerve gets affected, and therefore doing an audiogram becomes mandatory. Nearly 50% of the diabetics have a hearing impairment, and therefore doing an audiogram and keeping your sugars under control is absolutely necessary because it's a permanent type of a loss if it affects. Secondly, in diabetics, also the external canal gets affected, which is called as malignant otitis externa. This is an infective condition, typically occurs in diabetics elderly, those who have a very lower immunological status or body defenses are low.
And how often do you recommend an audiogram to be done? As in, it's not part of all diagnostic lab packages, But how often would you recommend that a person does it after the age of 60, or if a person is diabetic, even younger?
Yeah, if he's diabetic, or meaning normally we advise after 40 to get a hearing test done. Otherwise, routinely after 60 years of age.
Right. So that's 1 year, once a year. Is that what you recommend, or once in 2 years?
Once in 2 or 3 years is also enough. I mean, if it is normal, there's no need to get it very often.
Yes. Thank you. We have a question from Mr. Bharat Mehta, who says, is the problem of hearing, could it be hereditary because of family history?
Definitely. Genetic causes, as I showed in the slide, that it runs in families. And typically, I mean, you find a hearing loss, which is, high frequency hearing loss, that they get certain genetic conditions would predispose a person to hearing loss at an earlier age. So if there's a family history, strong family history in the parents or grandparents, then it's advisable to get a hearing test done much earlier.
Right. A question from Bharat Ganjawala, who's asked, can one try a cochlear implant without an invasive procedure?
Yeah, not today, because we have to open up the inner ear and, do the surgery. But this is still in the experimental stages. It doesn't have US FDA approval now. They have done it at Stanford, where they have done it in animals, where pigs and all, where they've done stem cell implant to regenerate the hair cells of the cochlea. So, I mean, once that gets through, then it will become non-invasive. But as of today, it's an invasive surgical procedure.
Right. Thank you. We have a question from Mr. Suresh Ghate, who's 68. He says, in both my ears, there's a lot of itching, irritation that takes place, and therefore I have to use buds at least 2 times a day. Why is it happening, and what is the curative and preventive action to be taken?
The first thing is that I would tell him to go first throw away the buds that you have, because the more and more the buds you use, it will introduce infection, cause trauma to the ear and damage the ear. So first of all, do not use buds at all. The cause of buds most commonly is water entering into the ear after a shower or a bath, and the ears are not dried enough. So therefore, water is one of the commonest causes. Second reason would be formation of wax. Wax is a natural collection. It's not a disease. So don't bother about wax collection. You can use ear drops and the ears will be clean. So if at all you find itching, the first thing is make a fist. Avoid putting anything into your ear, because the moment you put something into the ear, you are bound to cause some amount of trauma or damage.
Right. Thank you. We have a question from an anonymous attendee. Is it necessary to use Solivax every Sunday? What does it do apart from softening wax?
Yeah. See, now I'll tell you, the formation of wax is physiological. It's the desquamation of epithelium, the skin, with sweat glands, and that forms wax. So wax is no disease. First of all, remember that. Secondly, wax is formed naturally. Wax is thrown off also naturally. When we eat, when we chew, there is there's a centrifugal force which works on the ear canal. The jaw bone, it hits on the ear canal, and that centrifugal force throws off the wax also. So wax, unless the canal is very narrow or there is some other issue with the canal, wax will be thrown off. So you need not use these drops at a regular basis at all.
Right. Thank you. We have a question from KD Dadanji, who's one of our regular attendees. Says, Doctor, my husband is 76 and he has a hearing problem since a couple of years. Doctors have advised him to wear a hearing aid, but most of them don't work, or you get a buzzing sound. The very good imported hearing aids are very costly, and they informed him that even if a drop of water goes in, they will stop working and can't be repaired. Can you suggest an aid that is reasonably priced and yet works well?
Yeah, I think there's no need to go in for imported ones. Even the local ones will be good. And basically, they have to be programmed well. And I mean, I don't think I should still persist and use a hearing aid. Try to use ones which will, cut off the sound or get them programmed well. And he can get, because much better, the whole technology has changed now. In fact, all these programmable ones, you can do it from your phone itself. You have various apps where if you're supposing crossing the road, it will cut off the traffic sound. If you're at a station or you're at the airport, the background noise is cut off. The wind sound gets cut off. So it makes speech more intelligible, actually. It makes speech much clearer. The frequencies which are affected, they will be amplified more as compared to the other. So it can give something like a normal speech. And since with technology improving daily, much better aids are available, they should go in for them, and they're becoming cheaper also with time.
Right, thank you. We have a question from an anonymous attendee who's a male 69. He says that sometime wax-like substance forms into minuscule balls and that rolls out from his ears. What is this, and is there any cause for worry?
As I said, basically wax is a natural collection. And this wax, which is a natural collection, also has certain antibacterial properties. Wax is rich in antibacterial agents, immunoglobulins. In fact, I'll tell him, he'll be happy that in those whom we see wax, we don't see infection in the ears. We are happy that there won't be infection in the middle ear also. So wax coming out should never be considered a disease. It should be never considered a pathology. It is a natural phenomena. Some of us genetically are prone to excessive wax production. You cannot do anything about it, but do not use buds and do not get bothered by it.
We have a question from Dr. Om Prakash Agarwal, who asks, is hearing loss caused by trauma or accident? Is it curable? Hearing loss, when it's caused by trauma or accident, is it curable?
Yeah, I would like to tell Dr. Agarwal that it depends where the damage is. Now, if the eardrum or the ear canal has got damaged, it's a conductive loss. So any trauma or damage which occurs in the external ear, occurs in the middle ear, is totally treatable. The hearing becomes normal as before the injury or accident. But the hearing which is affected in the inner ear or in the nerve or at the brain level will be permanent. So it depends where the injury has formed.
Thank you. We have a question from Mr. Prakash Munshi and from Mr. Narendra Shah about the impact of mobile phones on hearing. What is it, and what should one do to ensure that your ears don't get impacted?
Yeah, I mean, it's absolutely, I mean, we have seen so many patients who have used the mobile for long periods of time, or even with a single call, I've seen them, they have come with a hearing issue. So basically, excessive use of mobile phone does damage the hearing. It is, at least I can say, it is not good for the ear. And what one needs to do is keep calls as short as possible, or use the speakerphone or a landline if one has long calls. So, I mean, we have a lot of studies also on this, and we have patients who we have shown that for mobile radiation, we have to keep away to protect the ears.
But Doctor, mobile phones are now part of our lives, and there's really not much that we can do. And especially, for those of us for people like myself who are not yet senior and who are working from home, most of our communication is done on the mobile phone. A whole lot of us, and I'm sure people here also, have done away with their landline phones and now only use a mobile phone as their primary phone. So clearly there has to be some solution to the whole issue of how do you do. It's not really possible to put the speakerphone on all the time. So what do you recommend? What is the because I'm sure this is a global phenomenon. This is a global problem. What is the thinking and what is the right solution from across the world?
As far as possible, I mean, you can use even texting, and at the same time, I mean, what I do is otherwise I use a speakerphone or a handset, because the thing is, I have seen patients suffering with, or even with a single call, somebody who had a call for an hour, 2 hours, and they come with tinnitus, they come with heating around the ear, they have come with even dizziness. They have documented hearing loss also in these patients. So, I mean, personally, I would say that continuous use or a use of mobile should be a little restricted as compared to, see, because the radiation which is given by a mobile is similar to a microwave, but the mobile is kept on the ear itself, close to it. You don't put your head into the microwave when you're owning it. I mean, so thing is, when you're so close to it, you can keep the distance a little away from your ear, one. Secondly, don't keep it close to your body. I mean, it is written even in the manual of the Apple phone that, it has to be so many millimeters away from your body, so many millimeters away from, it's all hidden in the full, you can say, when you buy a phone, all the things they have written about it. So, so I mean, if you feel it is too necessary, use it. But I mean, you should also be aware that of the damage that it can cause to the ear or to the inner ear.
And Doctor, what is your view about the various earpieces that are there? There's, some which is in ear. There are these pods that are there, which you fix it. The Bluetooth devices. How damaging are these for the ear? So you may not stick your mobile phone to your ears, but then you have these which are connected.
So these devices have to be, again, the volume has to be well under control. If you keep the volume too loud, as I've shown, that noise-induced hearing loss is the commonest cause of hearing loss in our society today. So typically when we do an audiogram, we find a dip at 4K, 4000 hertz, that is. And the fact that when you can see that 4000 hertz is getting damaged, it is the most sensitive frequency of the human ear. In the whole cochlea, it is this 4K which is facing the outside sound. So all the brunt is borne on 4K. And typically we see the audiograms in these people who excessively use it, the 4K dipping down. So somewhere the noise is affecting the ear. And I would suggest that if you can keep the volume lower as much as possible, it would be beneficial. Because this is a permanent loss. This is not a temporary loss. Because there are two things: when we are exposed to noise for a short time, in the ear, there is a temporary threshold shift. The hearing goes down, but if you give the ear rest or full night rest, for example, again, next day morning, the hearing will come back to normal. But if that noise, one is exposed to that noise continuously or regularly, it becomes a permanent threshold shift, and that will be not treatable.
We have a question from Yasmin Todiwala regarding noise. He says, I'm 72, but I can't tolerate loud noise, even sometimes TV sound. Why does this happen?
Yeah, very paradoxical, good question. That this is, see, again, in the elderly population, they have a hearing loss. But when you put the TV on a louder volume or there is a noise, it affects them more. Because what happens when the ear gets damaged, it is the protective features of the ear also which get affected. In the ear, we have a primary and a secondary filter. Filter meaning, supposing there's a loud sound like a firecracker or any blast. By the time we put our hands on the ear, much before that, our ear has a reflex protective mechanism that filters these sounds. Before the hands will go to the ear, the sound would have otherwise already damaged the ear. So when one has a hearing loss, or what you can say age-related elderly person having a hearing loss, the neural filters, all secondary filters in the cochlea also get affected. So when you raise the sound loud, that filtering is also affected, and that will irritate them, that will damage. So it is very paradoxical, hearing loss plus getting troubled by loud noise.
Right. Thank you. We have a question from Mr. Rohit Desai, who says, my sister had got her ears totally damaged 40 years back during some chicks infection. She can't hear totally. Any solution now? Her nerves are damaged.
Yeah. So if the nerves are damaged, there are two things. If the speech was already developed in the past, if the speech is developed, then a cochlear implant will help to convert the sound energy to electrical energy, which is directly connected to the nerve. But if the speech has not been developed, then there is no solution to this. One will have to think of sign language or lip reading or those things.
Right. We have a question from uh, from Mr. Dilip Desai says, I'm 73 and having giddiness for the last few days. As per the ENT specialist, it's because of hearing loss. How far is this true?
Yeah, as I'd shown in one of the slides, that the inner ear has two parts. One is responsible for the hearing and the other is responsible for the balance. And the balance majorly in the human body is controlled by the inner ear. So many conditions which will affect the hearing will also affect the balance of the other. So it is true that if your hearing is affected, your balance will also become weaker.
There's a question from Bushra Tasneem who asks, does the diet also affect hearing?
Definitely. As I said that in diabetics, nearly 50% of the diabetics have a hearing loss. But at the same time, those who have hypercholesteremia, that is the cholesterol levels are high, the triglyceride levels are high, all these metabolic conditions, what we call, will also affect the hearing.
Right. Thank you. We have, Doctor, we have questions flowing in like crazy. And but it's amazing that you've answered around 30 odd questions already.
Thank you.
We have a question from Mr. Shahid Mohan, who says, I have ankylosing spondylitis. I got audiometry done, and that showed a loss of high frequency sounds, but I can hear with the headphones clearly. So what is correct? Which is the best earphone? The cost varies from 15K to 3 lakh. I'm 66 years old.
See, as far as the cost is concerned, I think the larger hearing aid he uses, the better it is. Then instead of using a in the canal or completely in the canal, he can use a behind the ear hearing aid, one which is behind the ear, because it will have a larger area of catchment of sound. So he will benefit better and it will be much cheaper also.
Right, thank you. There's a question from Shahnaz Vanavati, who says, my mother is 87, a diabetic, and has developed a speech discrimination problem, which is why hearing aids don't work for her. Is there a remedy for this?
Yeah. So what happens that, especially in diabetics, as I said, the inner ear is affected. And with the inner ear affected, you can only hear sounds, but cannot decipher between the sounds. This is typically a sensory loss, which has gone beyond a certain stage. It's very difficult to, I mean, with the speech discrimination down, yeah, she'll have to consider using a more, you can say, higher channel hearing aids. Like you have hearing aids having one channel, 3, 5, 7, 12. So you have to go in for a higher channel hearing aid.
Right, thank you. We have one more question from Mr. Rajpal Singh. He says, ask any exercises you would recommend to improve hearing?
Basically, doing a Valsalva's maneuver, which is forced expiration on a closed glottis, will open up the eustachian tube. You can pinch the nose, keep your mouth closed, and blow air in the cheeks into the ear. So this will push in the sound, the air, open the eustachian tube, and ventilate the middle ear. So it will help in movement of the eardrum also. So for conductive losses, this is a good remedy to improve your hearing. So you can just do blowing exercises.
But is this fine for even people who do not have a problem?
No. Everybody can do it, but especially if most commonly when the eustachian tube is blocked, this will open it up and treat a conductive loss basically. But everybody can do it so that at least the eustachian tube remains functional. Especially what happens then when they go in a flight, they complain that my ear gets blocked, or when in a high speed lift, the ear gets blocked. So by doing this, once the eustachian tube is functional, this ear problems will not occur because of heights, because of travel, because of colds, etc.
Doctor, can I request you to just show it to us once again a little slowly?
So basically, with between your thumb and the index finger, you just pinch the nostril, keep your mouth closed, blow your cheeks. You will feel a sensation in both the ears. And if you don't feel it, that means the eustachian tube is blocked. So what you can do is you can do this blowing exercises 4 to 5 times a day. for maybe a 15-20 days, and then you will find your eustachian tube opening up. So this will help the middle ear to be open. It will oxygenate the ear, and majority of the ear diseases like perforations, etc., in the ear occur because of this. So once the eustachian tube is fine, next time when you get a cold, it will not affect the ear. When you're traveling, as I said, would not affect the ear. So doing blowing exercises is not only useful, it will prevent damage during plane travel also.
Thank you, Doctor. We have a question. Somebody has asked me to take his question from Nimish Shah. His question was, in metropolitan cities like Mumbai, at what age does hearing loss start, and at what age does it start as per your experience?
See, we find hearing losses even in the younger population. Now we are talking of the elders, but even we see it at, you can say, 40. So if one is exposed to noise, if one is taking aspirin or has any other medical problem like diabetes, etc., or one has a family history of hearing issue, one keeps on getting cold quite often, or as I said in one of the slides, that feel that you miss words, or you have to ask, pardon me, can have. So thing is, if any of these symptoms are there at 40, one should get otherwise tested.
Doctor, there is a supplementary question which is from Mr. Desai about his question about giddiness. So he asks, will your hearing aid help cure the giddiness?
Yeah. So basically, again, coming back to one of the slides, that if there is an amplification of sound in the ear converts sound energy to electrical energy, and this electrical energy which travels via the inner ear nerves, from the nerves to the brain. So when these electrical activities occur, the nerve regenerates, and that will help in maintaining balance also. Because thing is, when the sound is not entering, there is no activity, as we've seen, that use it or lose it. So if you do not use the ear, the nerves and the inner ear starts degenerating, and that will also affect the balance to a great deal.
Right. We have a question from Mr. Alan Fernandez. He asks, are you based in Mumbai? So I will answer that yes, Dr. Divya Prabhat is based in Mumbai. And where do you practice from? And is there a way in which they can reach you?
I think I'm based in Mumbai. I'm based at Dadar.
Yeah. So what we'll do, Doctor, is I can share your email address, and if you have a clinic number on the takeaways when we carry, and so we will carry this the edited video as well as the takeaways on Monday on Seniors Today, and you can have a look at it. And at the end of it, we will mention the coordinates where you could reach Dr. Divya Prabhat in Mumbai. You can reach him via email, and if there's a number, he could also, we could reach him on that. In the meantime, there's an announcement coming up, so please don't go away. Thank you, Dr. Prabhat, for being here and for this very explanatory presentation that you had, and for answering around 30 odd questions so patiently. I'm going to request you to hold on, everybody, and I'm going to request our producer to make a small presentation. So as we speak, we've just about closed the latest issue of Seniors Today, which is going to be out later this evening. This is what the cover is. Now, it's an annual exercise that we have now, our second year, where we look at the 50 most influential seniors. They are all 60 pluses, but they have made a significant impact on Indian society. It is right now not up on the website, but it will be up in the next couple of hours. So you can go to seniorstoday.in and download it. But I'm going to give you a quick look through of the magazine just for your thing. This is the first time that is being shown. You are seeing it, all of you. So this is what the contents are. As I said, we have a thing of most influential seniors. We have resolutions for a healthy and hence happy New Year. There are our columnists, Mr. Nagesh Alai, Mr. Prabhakar Munkur. There's Dr. Nandini Saini, who is talking about keeping a medical schedule. Dr. Beenal Dave, whom we've had in the past over here, a leading physiotherapist. She's talking about staying fit like a gift of self-love. Some of you may remember when she was here taking our session on December 25th, I had made this open request to her to write this article. So she's there. Mr. Navneet Sahni is talking about his travel piece, and there's our regular music columnist Narendra Kusnoor, who's talking about Punjabi songs which are beyond Bhangra and the Shadi songs that are there. What is the list like of the most influential seniors? I'm not going to ask. I'm going to request the producer not to show it, because for that you need to go to the website, see the list yourself. Think about. My suggestion is think about who you think would be in the top 10 or top 50 if you can, and see if your list matches ours. And perhaps we should have been doing a contest around it, but I don't think it's an appropriate thing to do. So we do look at it. It will be there. We are now at 6 o'clock, and it'll be there in a couple of hours from now. Thank you, Dr. Prabhat, for spending so much time on a Saturday evening with us. And for all of you over here, stay safe. And we will be there once again next Saturday with our next session of Health Live at Seniors Today. Thank you once again, Dr. Prabhat.
Thank you.